York City.
The CDC is reporting that people with diabetes might be at higher risk of developing some of the more severe symptoms of COVID-19. Jack Watson spoke with a local expert about the threat and has some ways those with diabetes can keep themselves safe. And Jack joins us now.
Adam, for people living with diabetes, staying at home is all too important right now. According to one local expert, there are a few precautions you can take. University of Rochester student Bradley Martin is home early. Instead of a desk or a lecture hall, this is where he goes for class now, an adjustment for any student.
It's definitely a lot different, yeah. Like, I can't see my friends. I don't see my roommates anymore.
Staying online only is more important for Bradley than most. He lives with type 1 diabetes, meaning if he got COVID-19, he'd be at higher risk for developing more severe symptoms.
I have not really left the house at all, especially because I know how dangerous it is if I were to get the virus.
Dr. Michael Cortuccio is an expert at Rochester Regional. He says for people living with diabetes, it has a lot to do with the immune system.
We're not absolutely sure if it makes people more predisposed to getting the infection with diabetes, but we know when they do, they get a more serious infection. And again, most of that centers around the immune system's not working quite as well as it should be.
Cortuccio says folks with diabetes should follow a few guidelines, maintain a healthy diet, exercise, and most importantly, keep close track of your glucose. High levels could mean something's wrong.
It's not uncommon. Sometimes people with diabetes, especially on insulin, might occasionally see a glucose in the 200s when they're normally under good control. But if they're consistently and persistently elevated, that could be a first sign of infection.
Adam, that expert is also encouraging people with diabetes to write down your glucose levels and give your care provider a call if anything is unusual. Adam.
Very good, Jack. Thank you. If you do live with diabetes, another thing you should know, Rochester Regional is mainly consulting patients by phone or by video call, reserving in-person visitation for emergencies. Also, the CDC found people with heart and lung diseases are also at a higher risk.